Assistant reproductive technology, what we call ART. What is it? In this list, I'll talk about those conditions. The first one we think of, it's an IVF, which stands for in vitro fertilization. The second one you can also recall is called GIFT, which stands for gametes intrafallopian transfer. The other one is called PROST, which stands for pronuclear stage tubal transfer, and TET as well, which stands for tubal embryo transfer. Then we've got what is called ZIFT, which stands for zygote intrafallopian transfer. And recently as well, addition of ICSI, which stands for intracytoplasmic sperm injection. Now, in this, I want us to discuss really broadly how we in Joburg Fertility approach our patients. The most important thing, especially in heterozygous couple, men and wife, we look, basically we start looking at the sperm. It's very important that we assess the sperm, do what is called semen analysis. The healthy and viability of the man's sperm is very important. We use the criteria of World Health Organization criteria of 2021. We look at the volume of the sperm. In other words, it must be more than 2.5 mils. We look at the concentration of the sperm. In that case, we're looking at something more than 15 million. Looking as well as sperm shape, or what other people may say, morphology. Then we look at the head, the midpiece, and the tail of the sperm. At least 4% of the sperm must be normal. And then we look at something we call movement or motility. We should expect in that case a 32% mortality. In other words, if all these criteria are met, then we said the semen analysis is normal. Now, the important thing as well, we in our investigation of infertility of ART, we also do the assessment of the female reproductive system, looking at the uterus. They're looking at, is there any adenomyosis? Is there any fibroids? Is there any endometriosis? Fine. Looking at the ovary with the scan, looking for cyst, polycystic ovaries, looking for follicles there, and then look for tubes if there's any water hydrosalpinx in the tubes or there's any sign of pelvic inflammatory disease. Therefore, after having all this assessment for both female and the male partner, then we can say what treatment modality we have. How are we going to treat this person, depending on all these four investigations which I've done. Now, the first treatment we can offer is called ovarian induction, whereby you give a fertility medication that can be any medication orally which they give, and then follow the patient and see that the patient ovulate, and then try by all means to make sure that they help we help the patient so that the ovulation time, the husband is aware and we have monitored and we know that it's happening within 72 hours. Now, with that, as I say, it's very important that the male sperm, which we started with, or semen analysis, is very normal for you to just do ovarian induction. And the most important thing as well, the female anatomy as well must be normal to do ovarian induction. It's not a good really idea to really randomly give a patient a clomid without really doing an assessment of the tubes, an assessment of the uterus, an assessment of the eggs, an assessment of the sperm as well. Now, the next treatment modality, it will be intrauterine insemination, all falling under ART actually. Then intrauterine insemination, some people call it IUI. Then it's mandatory that the female part is normal, and the male part we may try it when we see that the sperm concentration is low. But by low is strictly when the sperm is between 10 and 15 million. Anything below 15 million, 5 million, 1 million, or whatever, the sperm is too low, and then IUI is bound not to success and to succeed. Remember as well, IUI has a very, very low success rate. Therefore, in most of the countries and other states, I know in UK where I trained for a long time, they never give patient an IUI. They rather give patient an IVF because IUI, to really get good result, we have to do 6 of them to get only something like 15% pregnancy rate. Therefore, it's a really long time where patient actually has been under this monitoring, and it's time taking, and it's taking long and even frustrating sometimes to the patient. Now, the third form of treatment we have is IVF. Now, IVF basically is to assist the female pathology. That's the main problem, the main indication of it. Now, what are those problems which are actually addressed by IVF? It's like in a female side, female pathology. Then you're looking at the tubal obstruction, tubal endometriosis or endometriosis stage 4. You're looking at fibroids. It's affecting the connection of the endometrium or the cavity with the ovary. Therefore, the sperm cannot really, or the eggs cannot really meet each other. The last treatment I'm going to talk about, it's ICSI. ICSI stands for intracytoplasmic sperm injection. Basically, here, this modality or this treatment regime is basically for really a man problem, where you've got we can talk about the low sperm, we can talk about low motility, we can talk about low morphology or poor morphology, and we can talk about low concentration. Therefore, ICSI basically we identify in a man a good or a healthy sperm with a good head, normal head, with a good midpiece, with a good tail, and then inject that sperm in the eggs in the laboratory, in what we call the oocyte. And the whole process of fertilization is literally done mechanically with an instrument, so that we can see that it's happened, just to help the male factor. Although it can be done for other factor ICSI, especially when we have got a low number of eggs or something like that, we can do that. It's also increase your chances of pregnancy. Thank you.